all my friends from when I was younger, they all were drug addicts. I've been doing drugs since I was a teenager. Since I hit 13, I was literally on, you know, on something pretty bad. And so they've either died or I've had to put them out of my life so that I can stay clean.
When I first started here, about 80% of what came in the door was heroin. And over the past 5 years, that has teeter-tottered, literally to almost about the same numbers. So now it's about 80% coming in through intake are pills, prescription pain meds.
It's not a Delaware problem, it's actually it's a national issue, and the stats say it's just getting worse, and that prescription medications are becoming the drug of choice among individuals, and probably what's most concerning is children.
People started realizing that they could get prescribed pain meds for things that back pain. You know, my friend got in a car accident and had a slip disc and got 40 Percocets. Well, this is cheaper than doing heroin. You
know, we see a big problem in nursing with diversion of controlled substances. I mean, over the last few years, the board's taken like 150 actions against nurses, and 60% of those have been related to diversion or abuse of controlled substances.
I was on my 4th month of getting ready to graduate, and I still prescription pads from Bay Medical while I was down in Dover doing clinicals. Oh, I was devious. When I wasn't in my clinicals, I would sneak in the hospital, St. Francis, for example, and go upstairs to the orthopedic floor, and as everybody's casually doing their own thing, you know, the nurses and everything, I would sneak inside the doctor's office and hide under his desk and pull it open and find his prescription pad. I got away with it for like 2 years.
There's the mentality that if my doctor says I can take it, who are you to tell me that I can? It must be fine if an MD prescribes it. And I think that then goes back to responsible medical practice.
I was 19 years old and was getting 90 oxy-80s a month, and then he just started giving me 30s for breakthrough pain, and then he gave me Xanax too for anxiety because I was depressed. I mean, it's just, it leads you into the rabbit hole and you never come out.
The solution has to involve, it's got to involve practitioners who actually write the prescriptions. It's got to involve the patients, the public, who actually receive them. It's got to involve the pharmacists. We think it's got to involve the whole pharmaceutical industry. As a matter of fact, it's got to involve law enforcement and regulators.
Probably the two things that are going to have the most effect on this problem, in a good way, is the secure scripts that's going to be coming out. I think they're going to be mandated by March of 2012, where every prescription written by a Delaware pharmacist is going to meet certain standards. And make it very hard to replicate and duplicate. And the other is prescription monitoring program, which will allow people in the prescribing business to be aware of, if you're a doctor, you can access that and determine what your patient may be getting from other doctors. If you're a pharmacist, the same thing.
You know, I think as with anything, solutions evolve as the problem evolves, and so. You know, I don't know if I would go as far as saying long overdue, but it's definitely time for Delaware to have a prescription monitoring program in place.